It's just after 2 o'clock p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's regular briefing from the South Korean health authorities. We'll be getting updates on the latest figures as well as the latest measures being taken during this 5-day holiday period. We do know that as of Saturday, the country had reported 75 new cases. Of those, 52 were local, 23 imported. Let's listen into the briefing now.
First of all, here is Mr. Kwon Junuk with a briefing. Let us now begin our regular briefing for October 3rd, Saturday. As of today midnight, we have 52 new local infections, and the total caseload now stands at 24,027. 54 more people have made a full recovery, while 1,820 people are still in quarantine. And there are 104 patients in severe or critical conditions. Yesterday, we had 4 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the major updates of the domestic infections. And please note that the numbers could subject to change depending on the data accumulation time. First of all, in Seoul City Dana Hospital in Dobong-gu District, we have 13 more cases. A total of 46 cases have been confirmed to date. And moving to Incheon City, in relation to Somang Church in Michu-Holgu District, we have 4 additional cases. In total, we have 10 cases. And in relation to an acquaintance meeting in Bucheon-gu District, after the index case have been confirmed, 11 have been additionally confirmed, and a total of 12 have been confirmed to date. And in Gyeonggi-do Province in Pocheon, in relation to the Somang Community Nursing Hospital, we have 13 additional cases. A total of 14 have been confirmed to date. And in Yongin City, in the Daeji and Jukjeon High Schools, we have 1 additional case, and a total of 9 people have been confirmed to date. And moving on to Busan City, in relation to the Green Koa Public Health in Bukgu District, we have 1 additional case, and a total of 14 cases have been confirmed so far. And in relation to a business seminar, in relation to a health supplement business seminar in Yeonjae-gu District in Busan, we also have additional cases, and a total of 24 cases have been confirmed to date. And moving on to the imported cases, today we had 23 new imported cases. Of them, 14 have been reported on the points of entry, and while 9 have been reported through self-quarantine. And as for the countries of origin, we have identified that 12 were from Asia, 5 from Uzbekistan, and 4 from the Philippines. And from Europe, we had 3 from Ukraine, and also 3 from the US as well. And we have the Safety E-Report, which is currently operated by the Safety Ministry. And we have some examples of the reportings. And there was a kids cafe which was located on the basement floor, and people did not wear face masks, including the children and their guardians. And also in relation to a sanitary service facility, there were no face mask wearing, and also there were no use of the digital QR code entry lock system. And as of today, the remdesivir has been administered to a total of 529 patients across 60 hospitals nationwide. Last but not least, we have a few words about live quarantine measures. Until the end of the Chuseok holiday, we ask you to stay vigilant going forward, and especially we have many people returning to their homes at this hour, and please utilize your own vehicles, and please minimize the time of stay at rest stops. And please pack your snack and beverage before as well. And during the holiday, please note that the screening clinics are open as usual. So if you have any suspected symptoms, please get tested as soon as possible. However, please note that you can also access the information of the screening clinics on the portal websites, as well as the Ministry of Health and Welfare website as well as call centers like 1339 and 119. And during the weekend, we also ask for the religious facilities to switch to non-face-to-face means as for all of the religious activities, and please postpone and cancel all group meals and group activities as well. Last but not least, we have a few words for the public. As the numbers show today, the domestic COVID-19 cases are on a steady decline. However, we still have silent spreaders through the community, and we are also witnessing cluster infections centering around nursing hospitals as well as other health clinics. And in particular, we also see cluster infections and the high fatality rate among the senior citizens as well. And before and after the Chuseok holidays, we also understand that many people would come into close contact. However, this intensity of the contact will also determine the future outbreak in October, as well as the future policy directions in relation to us responding to COVID-19. Up until now, our members of the public have endured a lot of endurance and perseverance, and I have great confidence in the energy of the people, and we can overcome the virus going forward. We are also fighting against the COVID-19 in less than a year right now. However, we are also intensively carrying out tracing as well as tracking and testing of the COVID-19 instead of relying on a herd immunity system. And we believe that we have no other choice but to carry out these kind of responses. First, however, we also have not much of the knowledge of the COVID-19. Although it has been carried out in global level, however, we have seen that especially as for the male athletes, we have seen that the COVID-19 has brought some diseases in relation to their cardiovascular and heart disease aspects, and we cannot stay complacent as of now. And second, the fatality rate among the senior citizens is very high compared to other age group, as well as those with chronic illnesses also lead to a high level of fatalities as well. And we also note that these people account to about 1/3 of the global population, especially in the advanced countries. And third, the COVID-19 is also highly infectious and highly detrimental compared to the influenza outbreak, which can be witnessed in the winter times. And this is why the South Korean government is exerting our full efforts to contain the virus and flatten the curve and carry out proactive quarantine measures as well, and also adjust the social distancing measures as well. Lately, in August, in a country in Europe, we had a case I had an acquaintance who visited Europe and came back to Korea, who stayed for 14 days of quarantine. And he also told me that in Europe, they only check the passport for once. However, in Korea, after arriving in Korea, I met for 9 times the respective quarantine officials, and I also was guided to download a self-diagnosis app. And also, during my quarantine, I was also contacted by these officials on a regular basis. And this person told me that he had a great sense of pride in our country, and we were able to contain the virus to this extent thanks to the great participation by the members of the public. And during the rest of the holiday and during the weekend, we ask you to spend safe days. And also, even after the holiday, if you have suspected symptoms, please get tested as soon as possible by visiting a nearby screening clinic. Please note that early testing is very important, and this is the beginning of responding to COVID-19. And please note that even at this moment as we speak, there are many medical practitioners on field, and the local government authorities as well as volunteers and investigators who are exerting their full efforts. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.
Small business owners have been hit hard by the resurgence of COVID-19. According